Thank you, Omar. That was lovely, and I feel very humbled by your words. I can't take the credit because I actually have an amazing team of people that I work with, and of course connecting with peer workers. But welcome to all of you. It's just so wonderful to see the sea of peer workers here. And I'd like to start by acknowledging the traditional custodians of the land on which we meet, the Gadigal people of the Eora Nation, and pay my respect to elders past, present and emerging. And of course, an acknowledgement of people living with mental health issues. And quite specifically, peer workers. Congratulations to you on the amazing work that you do. And a day like today and a day like tomorrow are absolute recognition of the importance of the work that you do and how valuable you actually are. So we are delighted once again to be hosting the Consumer Peer Worker Forum and working in collaboration with the New South Wales Mental Health Consumer Peer Workforce Committee and the Planning Committee to bring you this exciting event. As a life member myself of the Consumer Peer Worker Committee, having been involved as a frontline peer worker with local health districts for many years, I am incredibly humbled to see the growth of the peer workforce over the past 16 years that I've been involved as a peer worker. So, a very warm welcome to the many people who I've shared this space with, and a huge welcome to all of the new peer workers. The work you do in supporting people, as I mentioned before, during some of the most challenging times for people, through some of the most challenging experiences that people will go through, is absolutely immense and pivotal to people's recovery and wellbeing journey. Now, due to COVID situation, a number of peer workers have not been able to join us, and I know that some LHDs mandated yesterday that their peer workers were unable to come. So I actually do want to acknowledge those that aren't with us today and haven't been able to attend, and to acknowledge and recognise that they matter and their work matters as well, and we keep them in spirit and in our heart. The Consumer Peer Worker Forum is steeped in history, as some of you may know, as the annual professional development event, where consumer peer workers working in the mental health sector come together to share, to learn, to grow, and to connect with each other. So if you're an old-timer of peer work, please do take the time to reach out to others who may be new and perhaps finding their way around these 2 days. And for our new peer workers, I hope the experience of being amongst so many peer workers is rejuvenating and revitalising to you and the work that you do. Coming to an event like this as a first-timer, potentially not knowing many people, can be quite daunting. Yet, I have to say the camaraderie that I've experienced, and I'm sure many others experience here at such an amazing event, is a true testament to the peer support that we provide each other. So please, I would encourage you to all connect with each other and step outside of the boundaries, get to know people from other local health districts and people that you wouldn't normally potentially get a chance to see. So through the COVID pandemic, it's meant the past year has been challenging for all of us. Being mental health consumers, still made innovative steps in several directions that have further highlighted the importance of embedding robust peer work processes to ensure both the expansion of the peer workforce in exciting areas, to include specialisations in education and research, but also the uniqueness the profession brings to the lives of those who access services and to the peer workers' lives themselves. And I'd probably add on to that as well, to services. You are making a difference to services every single day. We listened to what you said and what people living with mental health issues wanted. Opened up pathways for new and exciting roles, some of which, I was going to say you'll see on the screen, but I completely forgot to click. For those of you that know me, I'm not technologically minded, so it's fantastic that I've got a great team behind me to do that. Bear with me for one moment. There we go. So these are some of the innovative programs that we've commenced, and we're going to talk a little bit more about this a little bit later, but also talk in some of our presentations and workshops we have this afternoon. But there's a couple of snapshots of some of the great work that we've actually accomplished over this past year and a half. So like so many organisations over the past year, Being Mental Health Consumers transitioned its office to a working from home situation, which is never quite easy for a whole organisation to do that. We're heartened that we've been able to continue our valuable work, built on the foundations of 27 years of working in the sector. And I might note there is a consumer-run organisation. I think that's an amazing achievement. We've connected with people who access mental health services. We listen, we involve people, and we want to ensure that people are heard. In addition to our ongoing advocacy work, Being Mental Health Consumers progressed with a number of exciting and innovative projects, and I'd like to walk through a couple of those with you now. Some of you may be familiar with the model of peer supervision. Thank you to the New South Wales Government for allowing us the opportunity to develop a co-designed model of peer supervision for New South Wales to ensure that peer workers that were supported in their roles by trained, skilled and credentialed peer supervisors. And this is a first for New South Wales, so this is incredibly exciting. The Peer Supervision Project has seen 10 trainee peer supervisors trained and will shortly be supported to complete a 20-hour placement in order to qualify for the credentialing as a peer supervisor with Being. And the Peer Supervision Project will also have as an output a peer supervision framework, which will integrate all of the learnings from the project and provide best practice recommendations for peer supervision across New South Wales. We hope that this work will provide new professional opportunities for peer worker career pathways, as well as improving support mechanisms for peer workers across New South Wales. I know we have a couple of our trainee peer supervisors here today. They're probably going to be quite humbled, but can I just ask you to pop your hand up? How wonderful. Big congratulations to you. And we really look forward to furthering and experiencing this journey with you. Our Peer Workforce Network has been funded by New South Wales Health again. Thank you very much to the Ministry of Health. And this is specifically to develop a network of peer workers across the public, private and CMO sector. And we know that there's many peer workers that are outside of the public sector who would love to be able to come to events such as this. So we are looking at opportunities for inclusion of all peer workers and how we can bring all peer workers together. So this year we'll be exploring some of the things you've asked for, including professional development training, online reflective practice groups and peer supervision, as well as networking opportunities. And if you'd like to find out more, Peter's at the Being booth, and we have a sign-up sheet there where you can pop your name and details, and we'll be in touch with you very soon. I do want to note the Being suicide support groups. We were funded through the Towards Zero Suicides initiative to develop a consumer-led group process and implement it in a way to support people who live with suicidal thoughts, but also suicidal attempts. So several groups ran across Sydney and regional areas, facilitated by peer workers trained to share in supporting others. The program ran for a total of 12 weeks, and each week participants were able to work through a workbook developed specifically for the program. This was a really safe environment. There were closed group sessions, and the feedback we have absolutely been phenomenal. I do want to thank Beata. Do we have any other peer workers here that were part of that program? I'm not sure that we do, but thank you to Beata as one of our trainee facilitators and fulfilling the opportunity of running a group and co-facilitating a group. Thank you so much. We're looking forward to a potential for a phase 2 coming up later this year once we can work through all of our logistics. So thank you. And the Being Leadership Academy, a one-stop shop for training and professional development for people living with mental health issues, as well as supporting the further growth of the peer workforce to gain additional skills and professional development. So stay tuned for our 2021 to 22 calendar, the new calendar coming up, which brings courses such as an introduction to peer work, self-care for peer workers, setting boundaries, sharing your story as a peer worker, and of course, introductory pathways of professional development to peer leadership, and I know we've had many inquiries about that. So stay tuned for a little bit more. I do want to very quickly acknowledge the previous program that we had running, and thank the New South Wales Government, and I'll provide some further thanks in a moment, to assist us to establish a 6-month pilot program to support people of New South Wales through the initial difficult stages of the COVID pandemic. The peer-run warm line being supported, models saw being recruit peer support specialists, roles which expanded the scope of peer work roles in a specialisation of telephone support, including digital support and online services. And we are running some workshops tomorrow on digital peer support, so if you are interested in future training, come along to those workshops. I do want to express a huge thank you to the Minister for Mental Health, Regional Youth and Women, the Honourable Bronnie Taylor, who you met beforehand in the video, the New South Wales Mental Health Commissioner, Catherine Lowry, and also the team at the Ministry of Health for their foresight to see the importance of peer work and for supporting the evolution of being supported warm line. We hope to see the warm line back sometime soon. A little bit about our coming year. We're going to continue our core work in advocacy to lead and influence change across the mental health sector. We will have a greater focus on advocating for people's human rights and exploring the review of the Mental Health Act, which we hope is coming up this year. We've had some word that it potentially will, looking at Maria at the moment now, who may talk about that, I'm not sure. We are looking at completing the peer supervision framework and exploring the possibility of a second round of peer supervisors, which is incredibly exciting. Expanding the peer workforce network, the Leadership Academy, establishing a lived experience network, so please stay tuned for a little bit more information. We'll continue to advocate for the re-establishment of being supported warm line, so please keep your fingers crossed there and we'll stay in touch with updates of whether that comes to fruition. And some really exciting news, we are establishing an ambassadors program in 2021-22 financial year. So we'll be looking at ambassadors from across New South Wales and getting them involved with being, but also their local communities. And finally, this event couldn't happen without the following people and following organisations. Thank you to the New South Wales Government and the Ministry of Health for funding this event. A big shout out to the staff at the Ministry, particularly Lum Hewen, Jen Montgomery and Becky Walker. Thank you to you. We appreciate your support. Thank you to the Forum Planning Committee. This year we had Ryan, Andrew, Jemima, Naomi, Brooke, Nicholas, Richard, Ashley, Jen and Daya. A big thank you to Omar. He's our MC extraordinaire. This is the 3rd time running and we really appreciate your approach, your kindness, your humbleness and your generosity to give, and I really want to acknowledge that. A huge thank you to the Being staff. Wow. To bring this sort of an event together is a mammoth task, and particularly because of COVID, everything was delayed, so we really brought it together in the speed of light. So the team have worked tirelessly to make this event happen. Thank you to Peter for all of his behind-the-scenes work, to Anne, who is back in her old stomping ground after retiring from peer work. We didn't have to drag you back. We were just a quick phone call and Anne was there. So thank you, Anne, for assisting us over the 2 days. To the fab trio, they're somewhere, Leonie, Lisa and Anya. This team can make magic happen. I'm so incredibly thankful to this wonderful team who have worked tirelessly day and night to make these 2 days happen. Please do come up and say hi. I'd really like to say hi to those old friends, those old comrades and colleagues, and of course the new peer workers. So please make sure you come up and say hi. Say hi to the team. They'd really like to get to know you and have a chat with you. Please remember that you're not alone. There's always someone to chat with. If you need to speak to someone, the staff of Being are only a stone's throw away at the Being booth. Wishing you all a wonderful 2021 forum. and thank you very much for coming.